Good afternoon, everyone who's already joined. We're going to give it a few more minutes for people to continue to join us and then get started.
Hi, Sonal. I'm unmuted for just a minute.
Hi, good afternoon again to everyone who's continuing to join in. We're going to give it another minute or two and then get started. All right, good afternoon, everyone. So my name is Sonal Batra, and I'm going to be hosting this webinar. Thank you very much for everyone who's joining, and I assume we'll get a few more additions as we move forward into an hour. So just a few housekeeping things before we go ahead and get started. Everyone who is an attendee will automatically have their mic turned off, so you are muted. So you will not be able to speak or use the raise hand feature in Zoom. However, we do want you to be able to answer questions as we go through our webinar. So there's a Q&A box that you should be able to see in your Zoom menu. It's just a folder with a Q in front of it that says Q&A. If you click on that box, you should be able to type in a question that everyone will be able to see. Right now, there's no questions. So as questions come in, you'll be able to have an option to upvote a question. There's a little thumbs up icon that will show up next to that question. And you see someone just wrote merci beaucoup. I'm going to give that a thumbs up. And if you have your Q&A box open, you should be able to see that that has received a thumbs up. If there is a question that you see posted that you think that is important for us to answer, or you are going to ask someone something similar, you can go ahead and use that button, and that will move it to the top of the queue to make sure we try to answer them. We'll be doing most of our Q&A towards the end of the webinar, though we will stop intermittently to answer a few questions. If there are questions that are very direct and simply answered, we'll have one of our staff members typing in the answer, and you'll see that in the answered box in the Q&A. And things that will be answered live will be remaining in this list that you see now. As we go through, we're going to be, or I will be introducing you to a number of different panelists. And so you'll see different people's videos pop on and off as we switch speakers. So the purpose of this webinar is to review the Social Mission Metrics Initiative. I'm going to give you a brief outline of what we plan to cover. We're going to talk about the concept of social mission and kind of a broad overview, tell you a little bit more about how the Social Mission Metrics Initiative began and what we aim to do, give you some more detailed information about what it means to participate in the current initiative, as well as talk about the benefits. As we go through, I might refer you to our website that's listed at the bottom of this slide. It's socialmissionmetrics.gwhwi.org. This is going to be a relatively brief webinar. We anticipate ending no later than 4 p.m. And so we're not going to be able to give you all of the answers as we go. However, much of the information that I will discuss is elaborated further on the website, so I encourage you to please go there. And to answer the question that came in, yes, the webinar is being recorded and we will be posting it on the website later this week. So a very, very brief overview so that everyone's on the same page before we really jump in. Currently, the Social Mission Metrics Initiative is based around a free self-assessment tool that allows dental, medical, and nursing school leaders to measure their social mission. The whole initiative really encompasses the process of creating these metrics, distributing these metrics nationally, and creating an understanding and advancing the national conversation around social mission. And we'll talk more about how this all breaks down in a moment. I wanted to let you know who all is involved in this. So this study or this project is based at the GW University Health Workforce Institute, which is an interdisciplinary center at George Washington, focused on workforce issues. I'm an ER physician at GW, and I'm also a member of the GW Health Workforce Institute. One of my co-panelists, who you'll hear from in a moment, Dr. Fitzhugh Mullen, is the co-director of this institute, as well as a professor of health policy and pediatrics. On the right, you'll see the logo for the Center for Survey Research at the University of Virginia. Our second co-panelist, Dr. Tom Guterbach, is the director of this center, and he's a survey scientist who's been a consultant on the project from the very beginning. And the Center for Survey Research is currently managing a lot of the logistical aspects of the work that we're doing. This work is funded primarily by the Robert Wood Johnson Foundation, and it has been from the beginning. And we did receive 1 year of funding as well from HRSA, the Health Resources and Services Administration. I'm going to go ahead and pass it to Dr. Mullen to talk more about social mission and what that actually means.
Thank you, Sonal. Turn my video on. Oops, I thought I had. It says you cannot start your video because host has stopped it. Can you help me out there?
Yes, we are helping you out momentarily.
Good. And you can't hear me, I gather.
We can all hear you.
I will go ahead and proceed. Social mission is a concept which has grown up over the last 5 or 10 years. It's obviously something which is easily, it says start my video. You cannot start your video, it says.
We have you on video now. Fitz, you're all set.
All right. The idea of social mission permeates potentially the health professions. We're focusing particularly on the educational grounding of the health professions. That is what goes on in health profession schools, particularly in medicine, nursing, and dentistry. The definition that's really our kind of gyroscope here is social mission of a health profession school is the contribution of the school in its mission, its stated mission, its programs, its activities, and the performance of its graduates, faculty, and leadership in advancing, now 2 terms that are important and now familiar to everybody, health equity, and addressing the health disparities of the society in which it exists. So it is basically the neighborliness of the school, what it does about reaching out, particularly to folks at disadvantage in its community, defined as the local community, the local region, the society as a whole. And next slide, please. We got started in this area with a concern that had been abroad in the land in health profession education under many labels in many different ways. But when you put it all together under social mission, what we're generally talking about is what the institution does about engaging its community, what it does about promoting diversity, about trying to address the inequities or lack of parity of opportunity for particularly racial and ethnic minorities in the society, for studying the health sciences, what it does to reduce disparities in the populations that it works with. It's concerned with responsible stewardship for health resources, what it teaches about being a prudent prescriber and being responsible for the budgets of the institutions and professions that we work in. And finally, overriding concern was social determinants of health. So those are the general areas of manifestations of social mission in health professions education. Next, please. We set about studying this actually in 2008 and 9 when we asked the question, how could you measure the performance of schools and medical schools we were looking at the time? And we developed a very simple study in which we asked what their graduates of the 141 medical schools that were graduating students at the time, that's allopathic and osteopathic, what they were doing 10 years later. Were they in primary care? Yes or no? Were they in a shortage area practicing? Yes or no? And were they underrepresented minorities? Yes or no? And we simply ranked all the schools on those three criteria, and it came out rather surprisingly that the first three schools were the African-American schools, Morehouse, Meharry, and Howard. They did very well. Of course, they did well, particularly in racial and ethnic minority areas, but they did very well in the other two areas as well. And then there were a bunch of schools that are not well known, rural schools, schools in parts of the country that don't normally get celebrated. And when you look towards the bottom of the list, many of the best known schools really were not performing terribly well in these regards. And this caused a lot of consternation and a lot of questioning, you know, what is this thing called social mission? Does it exist? And we think in the better part of a decade since then, there's general agreement now that there is social mission, that it is something that schools can do, perhaps should do. But what we realized was we had gotten ahead of things from a research perspective. Outcome studies are usually later in the process. You start with more simple process studies about how a drug is administered or how outcomes develop. We'd really gone all the way down to look at outcomes. So we came back and asked the question of process. What do we know about what schools do that promotes these kinds of outcomes? And that really led us to this entire study of social mission metrics. How do you measure it? And finally, the survey, which is really the essence of the social mission metrics initiative that Dr. Batra and others will describe to you. So I'll stop at that and back to you, Sonal.
So thank you, Fitz. As Dr. Mullen said, I'm going to go ahead and tell you a little bit more about the history and the process of the Social Mission Metrics Initiative. So this project started back in 2016 with the development of a survey designed to measure social mission. There weren't any set metrics to evaluate social mission, although there were similar, somewhat similar tools in social accountability, which we'll talk about in a moment. We developed the survey. We followed up by testing and refining the survey. We created an analytic framework, and now this year we've recently launched a self-assessment campaign. The initial development of the survey really started with some core questions about what should be measured and then how can we measure it or what can be measured. And we answered this question by organizing an advisory committee. So this was our first advisory committee meeting, and a full list of members of advisory committees over the past 3 years can be found on our website listed at the bottom. We got together a group of leaders in health professions education from the 3 disciplines that the survey is directed to, so nursing, dentistry, and medicine, including people who were educators such as deans, those involved in national organizations such as the National League of Nursing or the AAMC, as well as health policy experts, people that were workforce experts, and other experts in social mission. And we really first started with what are the core components of social mission that should be measured. We included, we did this through a modified Delphi process where we had done some research on what other tools were available to measure similar areas such as social accountability or community engagement, and brought those to advisory committee to look at what was thought to be the most important tool. We then created a large survey, but tried to whittle it down based on what actually can be measured. So there was a number of areas that were thought to be important to social mission, but didn't lend themselves to very easy quantitative or qualitative measurements. So this was narrowed down by looking at what data sources were available and what we could actually look at. Through this process, we created an actual questionnaire that was broken down by categories. So we started with large domains. So a domain is a health profession's school function that has the potential to promote social mission. So these are very broad areas. For example, community engagement. Other areas include the educational curriculum or admissions. These are things that all schools are doing, but you can do it in a way that will promote social mission or not. An area is a subcategory of a domain, and we have 18 different areas in the questionnaire. So an example of an area under community engagement would be concordance of curriculum with community needs. Another area under community engagement includes community collaborations and other similar types of things. And then we have indicators. So that's broken down further, and these are measurable components of an area. Typically, each indicator was turned into a specific survey question. So an example under this area is, to what extent has the design of your school's curriculum been explicitly informed by the results of a community health needs assessment? And again, I have the website at the bottom of the slide here, because you can go to our website and look at a description of the 18 different areas that comprise the survey. So at the end of year one, we pilot tested the survey with 5 schools through a pretty extensive process. Each of these schools completed a paper version of the survey, and we asked for feedback on individual questions as well as the survey as a whole, and had telephone debriefing with all of the respondents in this pilot test. In year 2, we field tested the survey with a larger cohort of schools. Again, this was a mix of schools from the 3 disciplines that were targeted. We had 60 schools over 2 phases. And in between each of these 2 phases, we made changes to the survey based on participant feedback. We changed things like content and clarity based on what we received in the field tests. Towards the end of year 2, we also conducted site visits to 5 different schools. This was a mix of the 3 different disciplines again, and these served a few different purposes. So one, it was a form of qualitative validation where we got a sense of how schools were responding to the survey and if it matched what stakeholders or participants on the ground were actually feeling in their school's social mission. Secondly, and importantly, we also asked schools specifically if there were areas in the survey that they felt were left out, so things that they were doing to promote social mission that we weren't adequately capturing in their survey responses. And those pieces were added back in for the second round of field testing. So once we had this survey field tested and revised several times, we created an analysis strategy, which I'm going to pass it over to Dr. Guterbach to talk about a bit more.
Well, thank you, Sonal. Yeah, we had this long questionnaire with a whole bunch of items on it. And then the task is, how do we generate a score? How do we decide which schools are doing better on social mission than others? We know what's there, but how do we put it together? So we needed a way to statistically combine each indicator, those individual questions, into area scores, so we could score each of the 18 areas. But then we needed to also figure out how to put the areas together into an overall social mission score. And we came up with, after some puzzlement and some argument, well, I think this is important. No, I think this is important. We said, well, let the people decide, or more specifically, let the stakeholders decide. And so we launched and carried out a priority survey, which I'll tell you about in a minute. We used those, the weights that were derived from that survey to create scores for each area and then for the overall score for every school that was done in the pilot. And we plan to use the same scoring scheme for the results from this current initiative. Well, the next slide, please. So the priority survey was launched in April of 2018. We ginned it up kind of in a hurry because we knew that the Beyond Flexner conference was coming up, and we wanted to send it to the people coming to that conference. So we sent it to the Beyond Flexner conference attendees, to individuals who had helped us out in the field test and in the pilot institutions, and also to the members of our advisory committee. In all, we sent it to 694 people, and we did pretty well. 43% response rate, so people really interested to be in this survey. And what they did when they went to that survey was that they were shown all the indicators and asked to say which were most important within any given area. And then they were shown the areas and they were asked which areas are most important. And so one person would say, this one's very important. Another one would say, well, that one's very important. And someone would say, well, they're both about the same. But if you put all those answers together into an average, you then get a very nice ordinal weighting of all the, every indicator within an area and of all the 18 areas in relation to each other to suggest how to put together that overall score. So we ended up with stakeholder-derived weights for every indicator and then for each area, so we could make an overall score. Next slide, please. We'll just show you real quick what it looks like, for example, for several of the areas. The top-rated area out of all 18 was curriculum content focused on medically underserved communities, health disparities, and interprofessional education. Student involvement in programs that were specifically about health disparity or social determinants as opposed to everything else you learn in a health profession school, those got a high rating too. And so did the composition of the student body and the graduated classes. The diversity got high. It was considered to be very important as part of social mission for a school. If you look at what wasn't so important, having an allied institution in a low to mid-income country overseas, that was nice, but people didn't think it was that important. And you can see there are a couple of others as well. So these kind of numbers allow us to put together all the area scores into that overall score with some confidence that it reflects what people in this community think is important. And that's all I have, Sonal. Thank you.
Thank you, Tom. So as Tom pointed out, we have now created this analytic framework in order to be able to give schools some feedback on how they responded to the survey. I just want to mention a couple of things that were asked as questions. So one is that the slides are being recorded, or the presentation is being recorded and will be posted on our website later this week. Two, Tom was pointing out the results of this priority survey where we had these weights for each of the areas. There was also weights for each of the individual questions within the area. And I just wanted to point out that the spread of weights was not very large. So while certain areas were deemed to be by the stakeholder group more important, even the ones that were relatively less important still carried significant weight when we gave schools feedback on their responses. And I'd be happy to address more questions about that if people have them. So now we have created a survey, we have tested and revised the survey, and we have created a system where we can analyze responses and give schools feedback on how their responses compare with the national cohort. So the goal of this current self-assessment campaign is to distribute this free survey or this free tool to deans or health profession school leaders to understand their own social mission. Again, this is a self-assessment. This is in no way ranking schools or creating a publicly available viewing of how schools are doing. These are all confidential responses that are designed to give individual schools insight into what they're currently doing that manifests social mission. Last week, we've sent invitations out to all dental schools and all medical schools across the country, as well as a randomly selected population of 400 nursing schools. The reason we did all dental and medical schools but not all nursing schools is simply because of the sheer numbers. We did not have the manpower or the funding to be able to manage the number of nursing schools that exist in this country. And so we capped the number, though it is still the largest group that we've reached out to, as you can see. Here's some general information about the campaign, and again, more details about the process can be found on the website listed at the bottom of the screen. So this is an online survey hosted in Qualtrics. Every dean across the country has received an invitation to participate, including an individual link to their survey, and these were sent out last week. We estimated based on our field testing that it takes about 3 to 5 hours to complete the survey, and that's because the various forms of data that are requested usually require the respondent to reach out to different offices within the school. So for example, you might need numbers about your students' racial and ethnic backgrounds as they self-identify, or same with your faculty, and that will come from one place. You also may need information about your educational curriculum and what is or isn't included, and that will likely come from a different office. So it usually requires some collaboration amongst different offices, but typically there's a primary respondent. That primary respondent can be anybody at the school. So while we address the invitation to deans because we believe that the school leadership needs to support and be on board with this process in order for it to be completed, we found in the field test that it wasn't always that person who was actually completing the survey. Oftentimes the dean or other school leader would delegate it to an individual within the school, whether that was an assistant or associate dean or a faculty member, or even in one case a group of students who they thought would be particularly interested in this area, and gave them the go-ahead to go ahead and collect the information and report it into the survey. Similarly, many of you on this call are not the person who has received the invitation, but you can reach out to your school leadership if you're affiliated with a school to see if they intend to participate, and if you're willing, offer to assist in collecting the data. Schools, at the end of completing the survey, they submit their answers in Qualtrics, and then they receive a feedback report, which I'll review in a moment. And again, all of these results are confidential. So this is maintained, the survey is managed through the Center of Survey Research. So all of the results in Qualtrics go to CSR, the Center for Survey Research, and are maintained within this initiative. This is a sample of the feedback that school leaders will receive after completing the survey. This is a feedback report from the field tests, which we had about 60 schools, as you'll recall, participate. We're hoping our numbers will be larger in this national survey, and so we would potentially be able to give more detailed information than what we've provided here. But just to briefly walk you through this, so each of the areas is listed in the left-hand column. For example, one of the areas is school mission and the second is curriculum. The icons in the second two columns show how your responses compare to the cohort of answering schools. So compared to the 60 or 59 other schools that participated, how do your responses compare? Green means you're above the mean based on our scoring system. Red means you're below the mean, and an empty circle means you're at the mean. Again, with a larger number of schools participating, we hope to provide even more detailed information. This report gives you comparative information to schools across the country. And we heard from many school leaders that this is the type of information that they wanted. But again, it's confidential. It's only sent to the school who responded. And so it gives you insight into what you're doing compared to other schools. And it breaks it down by areas so that if one of these areas is more or less important to you, you can focus your attention there. In addition to the core point, or the core goal of the survey, of the self-assessment tool, which is to provide individual school leaders insight into their own social mission, there is a potential to really broaden the conversation nationally around social mission through the use of aggregated results. So this is some examples from our field test again. So we saw that across the three disciplines, about 60% of schools identified a community of commitment in their mission statement, and you can see how we define that term here. And approximately half of schools use the community health needs assessment to inform their curriculum. This gives us some insight into the national state of social mission broken down by these different areas. To summarize some of the benefits of the self-assessment campaign, the primary benefit as we see it is confidential insight into the current social mission progress at an individual schools. So in our field tests, we send these reports back to deans, and we had different responses about what they choose to do with them. A school can choose to do nothing with them if they want, but they can also choose to share it with other stakeholders and other leadership at their school to look at what they're actually doing in this area and think about how they might advance their social mission further. It also, through the use of potential aggregated data, can expand the conversation about social mission, not just at your school internally, but also nationally. I'm going to go ahead and pass it over to two guest panelists to share their experiences with the Social Mission Metrics Initiative. These are schools that have participated in field testing or pilot testing of the study, and can talk about what it meant for them and why they chose to participate. So first I'm going to turn it over to Dr. Maggie Wilson. who is a Vice Dean and Associate Dean for Student Affairs at East Carolina University School of Dental Medicine. And I see a number of questions that have come in, and I'm going to go ahead and answer those questions after we hear from Drs. Wilson and Greer. Thanks, Maggie.
Oh, thank you so much, Sonal. ECU School of Dental Medicine had the opportunity to participate in the survey pilot back in 2016. And our experience was that after completing the survey, we were able to provide feedback both about the survey in general as well as about specific individual questions. We had actually requested to be one of the pilot schools because we felt that collecting that information and seeing the questions that were being asked would allow us to have a broader sense of and broader conversations about the topics related to social mission. Also, we're a relatively new dental school, having graduated 4 classes and ready to graduate our 5th. And we have a very clearly articulated social mission. But yet at the same time, we felt that there would be some opportunities for us to learn more and more clearly define our own definition of social mission and what it would mean to us to be meeting that. And then finally, we also thought that we would learn more from other health professions schools or programs, not just dental schools, and learn how they express their commitment to social mission. And at the same time, it would also provide us with an opportunity to think more expansively and more interprofessionally. So it has been, completing the pilot survey was a wonderful experience. We look forward to completing this particular survey as well.
Thank you, Maggie. I'm going to go ahead and turn it over to Dr. Joe Greer, who is the chair of the Department of Humanities, Health and Society, as well as the Associate Dean for Community Engagement at FIU College of Medicine.
Well, Sonal, thank you very, very much. I think that what you all have done in creating this survey is of utmost importance, in particular when you look at the outcomes in this nation and where we have to change our medical education to get there. This is one of the most invaluable tools. I can't turn around and say how much fun I had filling out a survey. I never like doing that. However, this one is so important, and getting the feedback and looking at what other colleges of health were doing could only improve us in producing the future workforce in healthcare. I think that everybody should participate in this, and the fact that Fitz, you're leading this, and Fitz has been leading this stuff for years, is that it has to come to light the importance of the social mission that we have in our education. If not, we're never going to improve the health outcomes of this nation. So first of all, I encourage everybody to fill it out. I'm from Miami, so we're allowed to do it twice, just like voting. But it's really, really important to do that because we have to get this information out and we have to share it with each other to be able to make this a better place. And so I strongly encourage you to do this. Actually, here as an associate dean, we had a team that filled out the survey because there were so many different parts of it. And everybody truly did enjoy doing that.
Thank you, Joe. That's really helpful. I'm going to go ahead and answer some of the questions that came in before we move on to the next section. So a number of different attendees asked about if this tool will be available to other types of health disciplines, including physical therapy schools, physician assistant programs, as well as biomedical research. Right now, in the current paradigm, we've designed the survey specifically for dental, medical, and nursing schools. We started by looking at items that would be directly relevant just to those 3 disciplines, but as you can imagine, if there's something as relevant to those 3 clinical health professions, it's likely relevant to others as well. However, we right now do not have the logistical infrastructure to analyze responses from other types of schools. That said, this is something that we are strongly considering expanding to in future iterations of this work. And so I very much encourage you to reach out to us, and I'll have all of our email addresses towards the end of this presentation. If you are part of, whether that's a PA school or another type of health professions who would be interested in participating in the survey, we'd be happy to share with you a copy of the survey and discuss with you the parts that we think would be relevant and get your feedback in terms of applicability to that discipline. Tracy asked how we know who received the survey. The survey went out to the person who is listed on as the dean of the school, and if we were able to find that information, their administrative assistant. If you would like to know in more detail who we sent it to, please reach out to us directly via email. And again, I'll show those email addresses at the end, and we'd be happy to confirm with you who received it and who you can reach out to if you're interested in encouraging participation. The 60 pilot schools all did receive their results, or the 60 field test schools, excuse me. The pilot, we are calling that small cohort of 5 who we had in the first year, but the 60 field test schools received their results in late 2018 in the form of the feedback report that I showed you earlier in the setup. There's a question about within medical education if we'll be inviting separate responses from regional campuses as well as main campuses. And this applies as well to dental and nursing schools, many of which are split over several campuses. So right now, if the schools seem to be listed separately based on national databases, whether that's the AAMC or others, we have invited them all separately, especially if they have different educational leadership listed on their websites. If they prefer to be considered as one school because there's enough overlap, whether that's in their curriculum or mission or even student population, then they can choose to respond as one school. In our initial invitations, we've already had several schools tell us that they would like to be considered as one school or separately, and we can certainly accommodate that. I'm going to go ahead and resume the rest of the presentation, and then we'll get to additional question and answer towards the end. So actually, I'm going to go ahead and turn it over to Dr. Mullen to resume the rest of the presentation to close out talking about the potential impact of the work, and then we'll continue with question and answers.
Good. I'm back. You can hear me? Can you see me?
Yes, we can hear and see you.
Great. So why do we undertake this, and what do we think will happen from it? There's clearly a level of science in which we're trying to improve the measurement science around social mission. We're very good about testing educational missions, and in a variety of ways we look also at research missions as well as service missions. But this question of social mission, we probably have been less attentive to, and we hope we can improve the science around it, make it more regularized, more user-friendly, and more part of the educational conversation about what makes for excellence in health professions education. So the conversation is important, and we hope to stimulate others to both undertake this, perhaps to improve it, perhaps to refine it for different disciplines. And we're very happy that others beyond the 3 that we've kind of contracted with RWJ to pursue as a starter, but that other professions are interested in. We hope to see developments there as well. We also think that as we develop a better database, we will be the technology of doing this, which Tom Guterbach really pioneered and described very eloquently, is new, and we're still working on it. But as we get a bigger database, it'll be a stronger database in terms of establishing benchmarks and to be able to be more precise in terms of the consultation or advice that we provide back to schools. So all of this, I call it the ongoing research agenda, is very important. Next slide. So that sort of brings us to the end. I will say that we're very, very appreciative of everybody who has participated in both the pilot and earlier surveys, as well as those interested in this one. We think that the very exercise of paying attention to social mission is moving the field. It's establishing a better science, as I've described. It's promoting a higher level of attentiveness to this, the creativity that we need. These terms, these concepts, social determinants of health, health disparities, are really relatively new ways of looking at these problems. And while the terms and the concepts are very exciting, they present opportunities. But now to make those opportunities really sync up with the educational experience is another step beyond that many schools are experimenting with. And being able to capture that, to begin to measure it, score it, is part of a process of culture building. And we're very excited to be part of it, and thank all of you for participating both in this webinar and hopefully in this survey as well. So back to you, Sonal.
Thank you, Fitz. So I'm going to go ahead and answer a few additional questions that have been listed, and please feel free to continue writing your questions in the Q&A box that is available within Zoom. So Maureen asked if a new school that has not admitted students yet could participate. There are a number of questions on the survey that relate to students, the current student composition of a school, so they would not be able to completely answer the question. However, a school could still participate, and we would be happy to send that survey to the school. It relates to another question from Don Smith about what level or composition of response would we require before we'd be confident the survey results were representative of each subtype of school. Actually, I think thinking through that question, that might be asking something different. But I will say that for a school that is unable to answer all of the questions, so for example, if you don't yet have any graduating classes, in addition to giving you the general feedback report, we are also calculating a completion score for each school, and we'll be able to provide that information as well. So to go back to Don's question, what level or composition of response would we require to be confident that the survey results are representative of each subtype of school? I'm understanding that question to mean how many nursing schools, dental schools, and medical schools do we need to answer the survey in order to be confident that we are representing sort of the national cohort? While we don't have a direct answer to that, in our field tests, when we invited schools, including a number of schools who we randomly selected based on representative criteria for schools across the country, we had approximately a 33% response rate. So we're aiming to at least match that response rate in this iteration. We understand that schools that choose to participate in this survey may not be exactly representative of the nation as a whole. There may be a little bit of bias in terms of who is choosing to participate. So while we can't say that the average response will be exactly representative of schools across the country, we believe we have a large enough cohort in order to get a sense of where schools stand, excuse me. There was another question asked, two questions asked about if the current instrument is designed in a way that it could be relevant to community colleges. Right now, the simple answer is no. However, again, similar to what I said earlier about, for example, pharmacy or PA programs or other health professions, the survey is really designed focused on clinical health professions. But if someone is interested in collaborating with us to see how relevant it would be to these other types of institutions, we would be very interested in getting your input by sharing with you a copy of the survey and getting a sense of how much you feel it is or is not applicable. Is the tool applicable to all health professions training, including certification, undergraduate, and graduate postgrad? So that's an excellent question and something that we've considered expanding the survey to as well. Right now, it's focused on at the undergraduate level. In other words, medical schools, people obtaining their DO or MD degree, dental schools, people obtaining their DDS or DMD degree. And for nursing schools, it actually is targeted at both the bachelor's and the master's level. So in this phase, we did not reach out to schools that only have an associate's degree program and don't have one of the other types of programs, simply for a number of reasons. One was sheer numbers. Two was parity between the other professions, although we've had some interest expressed from a number of associate's degree nursing programs where we might consider this again going forward in the next iteration of this work. There was a question asked about if the survey will be available to medical schools that are not yet accredited. We pulled our list of schools across the 3 disciplines from national databases, so including for medicine, the AAMC, LCME, and the Commission on Osteopathic Accreditation. So if a school is listed as pre-accreditation status, they should have received an invitation to participate. However, if you're part of a school and did not receive an invitation, please again reach out to us and we'd be happy to share that with you. There's a question again about residency programs. I think I addressed that. Right now, we are not offering that, but one of our main areas that we're considering for expansion going forward is in fact to other types of programs. The survey opens, the survey has opened. The initial invitations were sent out last Monday, to most schools, and it will close right now. We have a date set for the end of March. However, if schools require more time to complete the survey, we can easily extend that, and we just ask them to reach out to us and let us know. There's a question about how we validate the answers, and I'm going to come back to that in a moment because I'm going to pass that to Dr. Guterbach. So the question is, how do you validate the answers? Every school likes to brag about their social mission. So I'm going to table that because I'm going to give it to him to answer after I address a few others. There was a question about whether or not we have something that includes a commitment to primary care, in particular to family medicine, whether a school is an orphan school. So yes, we do have specific questions about schools' commitment to primary care. For medical schools specifically, we ask about a number of different areas to assess that, including the number of their graduates entering those types of fields, as well as some of the curricular aspects related to it. And we have corollary questions in nursing and dentistry. There is a question about whether, so schools that include programs that are not part of the primary degree program. So for example, a school of medicine that contains programs that are not MD or DO programs. An example of that, I think, is a school that has, for example, a physician assistant program, or maybe even something like a medical assistant program, or in dentistry, a dental hygienist program. The unit of measure is largely the school, but we do ask about whether or not there are ancillary degree programs that are involved in the school. And I'd be happy to give you more details offline about what that means, or share the survey for you to view, Kai. Jewel asks, the questions seem focused on student experience and curriculum. Is there a domain that addresses leadership, commitment to social mission, and building faculty capacity? Yes, there are several areas or subcategories within a domain that address those things. So again, I'll refer you to our website where you can see a description of the 18 areas that are measured. But to give you some examples, we ask specific questions about some of the written governing documents of a school, including the mission statement and the strategic plan. We also ask about faculty training in specific areas, such as being able to understand social determinants and address them, as well as things like faculty activism as well. There's a question about nursing degree programs. So are DNP and PhD programs included? Now, this has been a complicated question from the beginning because of the number of different nursing degree programs that exist, as well as the different nature of training for those programs. So as you can imagine, something that has only online programs or doesn't have a dedicated campus will not be able to answer some of the questions that are really designed for schools that do have those things. So right now we focused on bachelor's and master's level programs with the understanding that the doctoral degree programs are continuing to expand very rapidly. And again, this is something that in future iterations of the work we hope to be able to address. So I'm going to pass it to Dr. Guterbach to talk a bit about what we've done thus far with validation and what we hope to do in the future.
Thank you, Sonal. Let me clear my screen here for a minute. Well, validation is always interesting with survey questions. There are some survey questions that you ask where you have a gold standard. You know, you can ask people if you voted in the last election, and you can go look up at the county clerk whether they actually did vote, although you don't see how they voted. But we don't have a gold standard for what we're measuring here. What we do have is that we spent 2.5 years developing the instrument in consultation with different schools. We have a lot of questions which are really operate on face validity. So if you want to look at diversity of the student body, you ask, okay, how many people do you have from each race or ethnicity? Those are really objective data that speak on their face to what you're looking at. And there was another question about whether we'll be able to validate our process data against outcome data, and we would love to do that in the future. Going back to the what schools did in the past as outcomes is probably not a good idea. We should probably wait a little bit, get their measure now, and then look in a couple of years to see if we can see outcomes such as, do their graduates go into primary care, or do their graduates go to places of medical care shortage. On the other hand, there are intangibles or things that would be much harder to measure. What do the graduates of these institutions think about? How conscious are they in their work of health disparities? How good are they at crossing the different divides? Those present challenges, I think. But I do have one other thing to say about validity, and that is that if we were publishing rankings, which we are not doing, then there'd be every incentive for the school to brag and exaggerate. But this is a self-study. We basically are going to feed back to each school, this is how you look in comparison to others, and the school that exaggerates its social mission and chooses the top scores just to get high scores the way colleges do for U.S. News, they're really defeating the purpose of the self-assessment. So it's in their own interest to be honest and clear in how they're doing, and it's really primarily for them to look at themselves and hopefully improve. That's the main purpose of the survey.
Thank you, Tom. And just to add on, there was a few other questions that I think accidentally got dismissed. I moved them back. So Thomas Scandalis asked if we did a confirmatory factor analysis, which we did, in fact. Tom, do you want to say a word about that?
Sure. Yeah, we did. It came out pretty good. It came out pretty good. The different areas loaded, almost all of them loaded on separate categories. So I think we're cutting at the joints here between these different items. So it was informative and encouraging, not perfect, but gave us evidence that we're on the right track.
We are planning on submitting another manuscript related to this work later this year, and we'll certainly be including more information about the degree validation thus far in that. And to reiterate a bit more on the point about correlating process measures with the outcomes measured earlier, we have considered that we of course only have those outcomes specifically for medical schools, which are a small representative of the sample that we're aiming for now. However, if we have sufficient data, we should be able to look at that correlation, with the caveat that that data, the previously measured data, is actually quite old now, but we may consider getting similar outcome measures going forward. So I don't see any additional questions. If there are any additional questions, please feel free to type them, or if you feel your question did not get answered sufficiently, either go ahead and add that in, or again, reach out to any one of us. Julie Orban, if you are someone who received an invitation, you would have had that invitation come directly from her. She's our research scientist and can direct questions, if you're not sure who to address it to any of us as appropriate. I just want to thank you all again for joining us and taking the time to learn a little bit more about social mission, and specifically about the Social Mission Metrics Initiative, and leave you with a few additional thoughts. So again, many of you are people who did not directly receive the invitation, so not the dean of a school, for example. If you are in any way affiliated with a school, or even regionally affiliated, working, for example, at a community health center or some other type of organization, I encourage you to reach out to us if you have questions about where this survey was addressed, or reach out to your school leadership to inquire about whether or not they intend to participate, and offer to assist if you're able and willing to do that, or at least encourage participating. So we appreciate all of your help. We will be easily accessible via email. And thank you again for joining us. I'll answer one last question, late breaking question that's coming in. Jamie's asking the time frame when we want these returned. We would like them returned by late March, ideally. However, as we mentioned before, the survey takes several hours, and depending on data availability, could take a little bit more than that. And so we understand there's conflicting priorities from schools. And so if schools do need more time, we can easily accommodate that. So thank you all. We're going to go ahead and close out the webinar. Just as a reminder, this will be posted on our website later this week, so please feel free to share with friends or colleagues who weren't able to join us today, who you think might be interested in learning more, as well as reach out to any of us or check our website for ongoing updates. Thank you.